we've convened a special panel of doctors and hospital leaders to talk about how dire the situation is specifically for kids and what solutions they'd like to see. Joining me now, Alex Munter is the CEO of the Children's Hospital of Eastern Ontario. Dr. Shazma Mathani is an emergency physician at Stollery Children's Hospital in Edmonton, Alberta. Dr. Jason Fisher is the division head of pediatric emergency medicine at Sick Kids in Toronto. And Dr. Janet Davidson is the chief medical officer of the BC Children's Hospital, as well as the BC Women's Hospital and Health Centre. Hello to all four of you. Thank you so much for carving some time out of your day for what I think and I know our audience will understand is a very important topic. I'm going to start west. Let's start west and move east. Just in, I hope, articulating how bad the situation is and how troubling the wait times are. And so, Dr. Davidson, I'll start with you because in BC today, the BC Children's Hospital website says the wait time right now at the ER is over 9 hours. What are things like there from your perspective?
So we are seeing longer wait times, but these vary through the course of a day acutely. And we are seeing an increase in volume. Our volumes are up 20% compared to last year. About half of the presentations don't need to come to the emergency department. And so we're also working on multiple strategies to help families know where to go and when to seek emergency help versus other forms of healthcare in the context of staffing issues, which all healthcare facilities across the country are experiencing right now.
I'll pick up on a couple of points you made and ask you, Dr. Mathani, about that. And we'll certainly focus on what strategies can be employed in a moment. But the fact that half of the cases presenting don't need to go to the ER, is that what you're seeing, Dr. Mathani? And if so, what does that tell you?
I'm definitely seeing similar trends here at the site that I work at in Edmonton. So most of the patients that I am seeing are being discharged home, typically with education, instruction, sometimes some fever management and reassurance to the parents. And so I think that's telling me a couple of things. One, understandably, parents are anxious. We're just coming out of a pandemic that was very different, a very different experience for everybody. And this could be new parents that aren't typically used to even having fevers or viral illnesses in their children. So looking for that reassurance. And second, we're noticing that it's also due to a lack of primary care in the community. So patients are without family doctors and pediatricians, meaning that right now the emergency department is the only place that they have to turn.
Dr. Fisher, what is it like at Sick Kids right now? And I would highlight one statistic that I know you mentioned to our producer. The wait time is around 4.2 hours on average, which maybe comparatively doesn't sound as terrible as some of the other times we're seeing, but that's still about, and you can correct me if I'm wrong, but 3 times longer than it was in October of 2019.
Yeah, absolutely. Very much the same story here. I think a large viral burden in the community is getting a lot of kids sick with fever, cough, and cold. And we're hearing the same thing, that traditionally these families would access care through family practice physicians, through pediatricians, local urgent cares and emergency departments, but they're just not able to access the timely care they've come to expect. And so they're turning to our emergency department.
And Mr. Munter, what are you seeing at CHEO? I mean, I live in this area and full disclosure, many people I know have experienced those long wait times. And I remember seeing a tweet from your hospital about how long it's gotten. Are you seeing this proportionally worse than it has been in the past? And what do you think is the cause of it?
Yeah, I think it's exactly the same circumstances that you've heard from across the country. We're seeing a surge in demand. So that's a viral activity, it's backlog care, it's mental health. And at the same time as there's this surge, there's also a decrease in other access points where families used to be able to go and can't anymore. So that's converging on children's hospitals across the country. And none of us were built for this kind of demand. So, here at CHEO in Ottawa, May, June, July, and September were the busiest May, June, July, and September in the nearly 50-year history of the organization.
Wow. Dr. Davidson, when you were referencing some strategies that are employed, as I listen to all of you, I sort of come away thinking there's got to be two kinds. One that addresses the immediate problem, and then one, and I'm not saying this is necessarily the hospitals or your strategy that needs to be employed, but one that addresses the larger problem of the lack of primary care that's available. If you're looking in the short term, what kinds of things will help?
Well, we're looking at a number of issues, Vashti. We're looking at helping families know when to come to the emergency department and when they can either seek care in other areas, recognizing that it's difficult at times, and BC is struggling with primary care significantly. And so that's one strategy. The other strategy that we're looking at is, everything we can do to improve flow through our emergency department, and that's ongoing. And we're focused on that as well, including putting people who can respond quickly to families' questions who are calling in, making decisions about whether to come or not, and ensuring that the right experts are available to answer those calls. So it's a multi-pronged approach to deal with the acute presentations now, because we know that this is going to increase through the fall as we expect the fall respiratory season with reemergence of respiratory syncytial virus, influenza, and COVID to occur through the fall in the pediatric population.
Dr. Matheny, I wanted to ask you about that as well, because I was watching American network news a few days ago, and it was like the lead story on their biggest show in the morning, the rise in respiratory viruses and specifically RSV in a majority of states south of the border. Do you anticipate the same thing happening here? And how worried are you from the perspective of being able to deliver the care that you know is needed and the ability of that being constrained by so many of the things that have been laid out?
I'm absolutely worried about that. I mean, if we look at what the respiratory season has been like this year alone, as was mentioned by one of my colleagues, the respiratory season was much later in the spring and lasted longer. And now we're seeing an early uptick and a pressure that's already being faced here in October. Looking at our colleagues in Australia, they're seeing a pretty severe influenza season, and that often predicts what we're going to see here in Canada. So my concern is definitely that we're going to see growing and mounted pressure with respiratory season approaching here. And that will mean increased admissions, increased use of ER services, and then added pressure to the wait times that we're already seeing, which of course the concern with that is having people potentially deteriorate in the waiting room, having bad outcomes in the waiting room, and that's something that none of us want to see.
Yeah, I think a lot of parents are watching thinking that's their worst nightmare. Dr. Fisher, this is a political show. I was saying to you all before the break that this maybe isn't necessarily the kind of thing that we normally discuss, but we do talk about healthcare a lot, and there's so much political jockeying around who should pay for what, when it should be paid for, how much money should be devoted to it. There's a lot of jurisdictional back and forth as well. I'm wondering for the ministers, both at the provincial and federal level, who are watching this program, and in particular this interview tonight, what your message is to them.
Well, I think during COVID, we proved that we can react and respond when the need is there. And we have when there's the political will and the folks are in the right positions to make change, we can do very quickly. And we can address these issues in the short term and the long term at the same time. But I think we really need to understand the issues in order to make sure the resources are used at the right point. So why is it that families are struggling to access care? And how can we improve that? And we've made some of those changes already. We've heard other panelists talk about empowering families to educate themselves, use tools like our virtual care platforms, but we're going to need to do more. And we can't do that at the front line. Everyone needs to work together as a system.
Mr. Munter, last word to you, and in a similar vein. What is your message to provincial and federal politicians who are watching tonight, who could help those of you on the front line enact some of the changes that will actually make a difference sooner rather than later, as parents sit here listening with some nerves?
Yeah, and so we're doing many of the things others are doing. We're putting nurse practitioners, physician assistants in the pre-triage line to support families. Maybe they don't actually need to come to the emergency department, and provide them some expert advice. We've opened urgent care. clinics. We're increasing our bedded capacity. That means we're recruiting. I'm wearing my recruiting T-shirt. Go to careers.chio.on.ca. We've got 447 positions. And really, I think the bottom line is that Canada's child and youth population is growing. The demand is increasing. And we are going to need investment in these services. We're going to need both levels of government to invest. And that likely means the federal government will need to increase its share to the 35% that's being recommended by provincial governments. And at the same time, the federal government has, I think, the right to expect accountability for those dollars and visibility on the impact that they've had. So I think the message to decision makers just down the street, we're about 3 miles from the Peace Tower here at CHIO, the message to them is everybody is working really hard. You've got the best people in the system working on solutions. You've got clinicians working day and night, and we're looking to support from all levels of government to help make sure that kids get the health care that they deserve.
Okay, I'll leave it on that note. Thank you very much, all 4 of you, for making the time for this. I appreciate it. Alex Munter, Dr. Shazma Mithani, Dr. Jason Fisher, and Dr. Jana Davidson. Thanks very much.
Thank you.
Thank you.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.